Hello and welcome. My name is Kim Peek. I'm with the Research Department. Thank you for joining us for this Evidence Matters curriculum. Today we have a presentation from Wendy Patillion, Regional Practice Lead for the Research Department, and it's titled Navigating QI Evaluation and Research Projects at AH. Hey, Wendy.
Great. Thanks very much, Kim. I have about a dozen or so folks on the line, so welcome to this session. We will certainly accept questions in the chat box for questions, so you can put them into the chat box. Please hold them, and we will certainly have time for questions at the end. I have presented this topic before, and I think the content's around 30 minutes, and then there certainly will be time for questions and discussion following the presentation. I'm going to give you an overview of navigating different types of projects in interior health. The Research Department and the Research Ethics Office, as well as the Quality Improvement Team at Interior Health, often receive inquiries from staff, physicians, and also external partners who want to conduct projects in the health authority. And often, or times, they're not sure exactly what type of project they're launching. So we will help provide resources to guide them through some questions that help them focus their project. So the overview of this session today will touch on some of the questions that we often deal with, and you can see them on the screen. So the first one, of course, is when does a project involve interior health? I'm going to look at the differentiation between quality improvement, evaluation, and research projects. When is ethical review required for a project is always a key question. What type of ethical review is required, depending on the type of project? Is operational review and approval required? And then at the end, I'll also just touch on some considerations for recruitment and consent and use of health records. So first, let's talk about when a project actually involves interior health and what policies apply. For those of us that are interior health employees or affiliated physicians, students, volunteers, all interior health policies apply to us. For those that want to conduct projects and are external partners of ours, we will still use the same guiding principles from the policies to guide the work within the health authority. Quality improvement, quality assurance, and evaluation projects. If the project will involve people and or their information, then policy AL 1600 for project ethics applies. This policy was first approved in October 2014. It is currently under review and will be revised and approved later this year. So a project might be led by IH employees, physicians, students, or external contractor. They all follow under the same provisions. Projects often use people's information in the form of personal or identifiable information, health or medical records, answers to an interview or questionnaire or survey, or participation in a focus group. So any of those types of project activities, you are involving people and their information, you need to have an ethics review. So for research, the jurisdiction of interior health is laid out in the board policy 3.3 for research and research ethics. All research involving human participants that is conducted in IH facilities or programs, by IH employees, physicians, or patients as researchers, or with IH employees, physicians, or patients as participants, fall under the jurisdiction of Interior Health and the Research Ethics Board. And the term patient here to mean any patient, client, customer, or resident that receives services from Interior Health. The definition of a human participant for research is taken from the Tri-Council policy statement and includes living person, their information or biological materials, as all human embryos, fetus, tissue, reproductive materials, and stem cells. So the definition of a human participant applies to all of those materials from either living or deceased individuals. So look at the difference between quality improvement, or QI as it's often referred to, and research. Because we often get asked, is it quality improvement or is it research? And sometimes a project, the way it's laid out, depending on the methodology, could be either or. But the key is that it can't be both at the same time. You do need to go through a process during your project planning to determine which route you want to go. So an article posted by the Institute for Healthcare Improvement in 2017 describes how to bring the best of quality improvement and research together in healthcare settings. It compared the two. So just look at some of the content from that article. This is not interior health, quality improvement, or research department's perspective on this per se, but there were some good guidance in this article from the Institute for Healthcare Improvement. So research helps us understand what works, also efficacy, and it often compares an intervention against a control or a placebo. Where improvement projects help us test these interventions in the real-world setting. We can do adaptations if necessary, and that helps us to understand how to effectively and efficiently implement them across a variety of settings. Both are grounded in basic scientific methods. Research starts with a hypothesis, designs an experiment to test it, and then collects data to see whether the hypothesis held true or is null and void. In quality improvement, a poorly designed PDSA cycle, also known as a plan, do, study, act cycle, will go through very similar steps. Research is often referred to as pure science, where data control for confounding factors and biases might influence the outcome of the intervention. It's more definitive about making cause and effect linkages. And on the other hand, is sometimes referred to as applied science, or implementation science. This we acknowledge that improving services in the real world is complex. Multiple variables involved cannot always be held controlled or constant, so that varies from research. Just a little caveat there, if you have this discussion with a team of academics, regardless of who they are, which faculty they're from, or which academic institution they're from, their definitions and perceptions on the two terms pure science and applied science will certainly engage a robust conversation. So both research and QI rely on data to guide the practice. Research will help us demonstrate which interventions have evidence to justify their use in a particular population or setting. And it has to be confirmed there, and then it can be generalized out to other similar populations or settings. Where quality improvement will help us demonstrate which changes lead to improvement in a given setting. Again, here we usually use the data and test on it to build our degree of belief that that particular change or improvement has merit. By evaluation or research, when you're planning a project, the answer to some key questions will help you define whether the project is a three. Our partners at Fraser Health have given us permission to share their document that differentiates the three types of projects by walking through the steps of a project, showing the different course depending on which stream you're going. A copy of the Fraser Health document has been included in the Outlook invite for this session today. To answer the questions posed here, focus on who will benefit from your project. The first question, what is the purpose of the project, is really key. And think about who you're doing the project for. Research produces results that can usually be generalized to future individuals with same characteristics as the sample population. Key evaluation projects, the results that you're looking for are usually local and not intended to be generalized across greater populations. Usually the results of QI evaluation projects are applicable to the existing practice setting where the project took place. This algorithm is also included in the session materials in the Outlook invite, and it demonstrates the review process for the 3 types of projects at Interior Health. The electronic copy provides links for multiple web page resources. Most of the resources are on the Interior Health Inside Net in our website. So those of you who are external to Interior Health, you can still access a lot of these resources by contacting the applicable department. Some of the research and research ethics resources are also available on IH public website. 3 teams, quality improvement, evaluation, and the research department at Interior Health have web pages on our internal website. We have extensive resources available to staff, physicians, and employees, and all 3 teams are happy to share and consult on any given project. Let's look at the review processes for each project in more detail. So improvement, I've put a definition of quality improvement there on the screen for you. This is one currently used by the quality improvement team at Interior Health. The team does have a number of consultants strategically located across the health authority. At Interior Health, the quality department really works with local, regional, and provincial teams to facilitate and drive system-level improvement. They focus on reducing potential risk to patients by continuing improving the safety and quality of the care that we provide. In Interior Health, we want to cultivate a culture where quality and patient safety is everyone's responsibility every day. So achieve the best possible outcomes through patient-centered care, teamwork, innovation, and learning. The consultants, as I stated, are available to review and provide guidance for QI projects. Every QI project should have an IH sponsor who provides the support and operational approval. And the project involves people or information. Ethical review using the ARECCI process is required. Evaluation is viewed as a systemic process, that is planned and purposeful. It collects data about questions and issues. It enhances knowledge and decision making, and it's an assessment about merit, worth, or value of what is being evaluated. The evaluation team is the senior executive team and the program leads in assessing whether IH programs are effective, efficient, and achieve the expected outcomes with the intended population groups. From evaluations can be used to create recommendations for improvement, inform decisions, create accountability, and provide opportunity for continued learning. The evaluation team will also provide education and coaching related to evaluation projects. Evaluation projects also require an IH sponsor and ethical review using ARECCI. People, their information will be involved in evaluation work. Let's talk a little bit more about ARECCI. The term ARECCI is actually an acronym created by Alberta Innovates Health Solutions, which stands for a Project Ethics Community Consensus Initiative. Interior Health has used the online ARECCI decision support tools since 2014 for the ethical review of QI and evaluation projects. The ARECCI process helps us to ensure that an ethical lens has been applied throughout the phases of project development. There is a systematic approach to reviewing ethical risk to project participants, the organization. It establishes accountabilities for managing those ethical risks associated with the project within a risk tolerance of the project team and the organization. And the tool continually improve the quality of health service delivery in IH by supporting the ethical development when we're actually planning and designing projects. So there are 2 ARECCI tools. The first is an ARECCI ethics screening tool, and it helps to determine the primary purpose of the project, types of ethical risks, appropriate type of ethical review. The second tool is ARECCI Ethics Guideline tool, and that tool helps project teams consider the ethical implications of their project and decisions that will protect the people and the information used in the project. What you're seeing on the screen here is a scoring that comes from the ARECCI screening when you complete it for your project. So if a project is screened to be more than minimal risk with a score of 8 or higher, opinion review provides for the project lead to consult with a second opinion reviewer who is trained in the ARECCI ethics program. The reviewer will meet with the project lead, review their project, review ethical risks identified, strategies to mitigate those risks, and then provide recommendations to address the ethical concerns with the project. If the project has a risk score of 47 or higher, then organizational recognized review is required. And that process is usually done by a team of second opinion reviewers here at Interior Health and may also involve other IH leaders depending on the type of project and the level of the risk and the risks identified. Jody Pistak, the leader for project ethics at Interior Health, is just currently reviewing and revising our process for organizational recognized review. You can access a request form for a second opinion review through the Untitled Project Ethics webpage. I want to look a little bit more at the ARECCI guidelines because these are really helpful questions that help any person planning a project to look at ethical considerations that they may not have thought of with their project. So when you're initially designing and planning your project and having those early conversations, reflect on a few of these questions. Project results be shared, and with whom? Balance how useful the findings will be. What method or approach will you use? And it provides details on the collection and analysis of the data. What method you're using is actually appropriate for what you're trying to achieve. Is sample size adequate? Treat participants fairly means that the inclusion and exclusion criteria are clear and that no one group of people is overburdened. What are the benefits of a project for the participants? And what risks doing or doing the project? Have risks been mitigated? Or can they tolerate it? The project team and the sponsor will have the final decision on those risks. The confidentiality of participants must be respected. Security is paramount. And identification of participants should be protected in publication. We can't just assume that people will want to participate in projects. Participants need to be informed about the project and they need to provide consent. They feel pressured to participate or be influenced to participate. And there should be provisions for them to withdraw even if they start participation and change their mind. So let's look a little bit more at research. The definition for research comes from the Tri-Council Policy Statement for the Ethical Conduct for Research Involving Humans in Canada. An undertaking intended to extend knowledge through a disciplined inquiry and/or systemic investigation. It was developed by the 3 federal research granting institutions, which includes the Canadian Institutes for Health Research. Actions to the Research Ethics Board are evaluated against the principles articulated in the policy, which is known as the TCPS-2. The Interior Health Research Ethics Board has a diverse membership of both Interior Health and non-Interior Health members with expertise in a variety of research and science methodologies. They also have community members and members from the legal committee. The research department has regional practice leads of diverse patient engagement, community partnerships in research, research with Indigenous communities and partners, knowledge translation, index and statistics, quality and compliance. The clinical research department also has a manager and clinical research coordinators who now support clinical trials across 3 different IH sites. Between the Research Ethics Board and the Research Department, we have a number of staff and a number of resources who can help you with your project. They'll support with plan design, methodology, facilitation, communication, review processes, and operational review processes. All involving human participants must have both ethical and operational approval before the research can begin within the health authority. And depending on the design of the research and the type of research project, other tracks or agreements might also be required. This algorithm demonstrates the review process for research in more detail because there are a number of different steps and they can seem quite complex and complicated at times to researchers, and hopefully the algorithm just helps guide the process a little bit. A copy of this algorithm was again included in the material sent to you with your Outlook invite. So the additional review process shown on the left side of this diagram in green, and the ethical review process shown in blue on the right-hand side can happen concurrently. As soon as you contact the Interior Health Research Department, and we start looking at the operational review or the operational considerations for your project, we'll ask whether or not you've initiated an ethical review. And likewise, if you submit a project first to the Research Ethics Board or the Research Ethics Office, they will start asking questions and make sure that you're connected to the research department for the other side of the process. We work in them together to try to facilitate both reviews concurrently and hopefully be efficient with time for the researchers. So the Research Ethics Review, there are 2 different types of Research Ethics Board review, and it is determined by the level of risk posed to the participants. PCPS2 uses the term minimal risk. It means that participants are expected to undergo no greater risks by participating in the research than they would encounter in their everyday life. These studies often go through what's called an expedited or delegated review process, not reviewed at a full Research Ethics Board meeting, but rather these projects are reviewed by a smaller subset of Research Ethics Board reviewers. Take is continuous, and the researcher can submit the project when they're ready. There's no submission deadlines. It is considered above minimal risk. It's always reviewed at a full board meeting, and those are regularly scheduled currently on a monthly basis for Interior Health. Following the delegated review process or the full Research Ethics Board meeting, a report of review with provisos will be sent to the principal investigator for the project with a copy of the report from the Research Ethics Board. This type of review may take approximately 4 weeks from the application is submitted until the Research Ethics Board sends you that report of review. So it's important to get information about the ethics review process early. Look at the application. There's a guidance document on the Research Ethics Board website for how to complete the application and the application process. And again, please contact the Research Ethics Office or the Research Department if you have questions about that. Usually the biggest concern is that people don't start the ethics review process early, and then sometimes there can be delays later on when the researcher wants to start their research. And so again, we'll try to help support your project in a timely, efficient way and help you get connected with these processes earlier. If a project does not meet the definition of research, but the lead wants to publish results in a peer-reviewed journal or a high-impact journal, some of those journals will require an ethical review or proof of ethical review of the work. So the Research Ethics Board is happy to review projects for application. That request has to come to the Research Ethics Board prior to the project being conducted. conducted. If the project has already taken place and the results are already finished, the manuscript's ready to go, ask for a Research Ethics Board review at that point is considered after the fact, and it's not appropriate. And the Research Ethics Board will not be able to accommodate that request. Likewise, a lot of people think that there is no process for ethical review for quality improvement or evaluation type publications. There are a number of very good peer-reviewed and high-impact quality improvement journals now available, and they often will respect an ethical review by a process like ARECCI. So the project is quality improvement or evaluation. You don't necessarily need a Research Ethics Board review. Your ARECCI Ethics Project review will probably suffice. One more on publication for research. If the researcher or any of the co-investigators have dual affiliations with more than one institution, and they want to acknowledge those institutions on their publication, then it is expected and appropriate that they ensure they get Research Ethics Board approval from both institutions. In BC, we often have researchers that are affiliated with Interior Health and one of the academic universities like University of British Columbia or University of British Columbia Okanagan, Simon Fraser University. If you have dual affiliate, you want to recognize both with publications, then please let us know when you submit your Research Ethics Board review, and we'll arrange for a harmonized review process that will cover that off. So let's talk a little bit more about the operational approval for research. Op review and approval is required for all research projects conducted in Interior Health. The application form can be downloaded from the Research Department website. Currently, it is a PDF fillable paper document, and then it can be completed and sent in via email. We will soon be moving to an online form in a REDCap database, and that will be launched this year during Research Week, the last week of September. So stay tuned, and there will be more information about that process coming. The form and the questions on the form are intended to help the researcher identify what resources they need from Interior Health to implement their IH administrators. They need to talk with their research, because those IH administrators will need to provide approval for the resources that will be used. If the researcher needs assistance determining which administrators to go to, which sites they need to connect with, they can certainly contact the Research Department, and we'll help, again, guide the process and make sure the researcher gets connected to the right IH administrators. In addition to operational approval, other contracts and approvals might apply depending on what type of research you're doing. So if the researcher is conducting a clinical trial, for instance, they'll need a clinical trial agreement. If there is a major data request with the research project design, and the data will be linked with data outside our health authority, or the data will be sent outside our health authority, a data sharing agreement or an information sharing agreement might be required. So we do have a few different types of contracts and documents that apply to different types of research projects. They're listed on the algorithm, and again, if you need support with those, you can contact the Research Department. All of the approvals required for a particular project are in place. The ethical approval from the Research Ethics Board is complete, operational approval is complete, and any other contracts are signed. Then Interior Health will issue a certificate of institutional approval. That will give you the green light to start your research project in Interior Health. So kind of a quick overview of types of projects in Interior Health and the different processes required to navigate them through our different departments and resources of our people and our programs and our IH sites. I'm happy to answer any questions. So maybe I'll just ask Sage and Kim to check the chat box and see if there are any questions.
Not in that box yet.
And do we want to open the phone lines, or are people muted?
Lines are open, so if anybody has a question online, please feel free to speak up, and Wendy's here to answer. there any questions in the room?
Then I have answered them with the content I've provided. So what we will do again, if you do have further questions, you can certainly contact me. There's contact information in the Outlook invite that was sent out. The easiest way to get a hold of any of us at the Research Department at Interior Health is research department at interiorhealth.ca.
No, it's research at Interior Health. or you can email me. I'm the one that sent it.
There we
go. I'm
go.
Kim Peek, and I emailed everybody the invite. So please feel free to you can connect with me, and I can connect you to Wendy, or I can field some questions as well.
And those of you again who are Interior Health folks, there are contact links in the navigation map for both the quality improvement and the evaluation team. And again, their contact information is also on their website as well on the Inside Net. The Research Ethics Board is also certainly open to inquiries, and their content is researchethics@interiorhealth.ca. And so again, please feel free to contact us either with any questions for this presentation today, or if you're currently designing or planning a project in Interior Health and you have questions or want some support with that project, please reach out to any of us sooner in your process rather than later, and hopefully we can help guide you along, connect you with the appropriate resources, and help your project go more smoothly.
And I want to thank Wendy so much for the wonderful and thorough presentation. It was wonderful information and very useful, I'm sure, for many people on the line and for me as well. I also wanted to plug our Research Week, which is happening at the end of this month, so September 24th to 28th, which will also talk about operational approvals going online. So if anybody hasn't heard about Research Week, please feel free to connect with me, and I can get you more information about that. And yeah, thank you so much for joining us today. Everyone have a wonderful day. Thank you so much.
Thank you.